purpose of these TADs is twofold. Number one, to provide a temporary fixed means of having a lateral ponic so that the patient doesn't have to wear a flipper or a removable retainer with a ponic. And number two, to maintain the bone width for the placement of the future implant. This new technology is something that we are now offering our patients as another means of retention. The problem with placing an implant before the patient is done growing is that it fuses to the bone and does not allow the normal downward and forward growth of the maxilla. These TADs are made out of stainless steel and they do not fuse to the bone. This allows the normal downward and forward movement of the maxilla along with the TAD. The primary benefit and the reason that I'm doing these now is to maintain the bone width in this area. So many times I have found that when a patient is ready for implants, that a bone graft is also necessary, which can be very expensive for the patient. Just this mechanical tension of the TADs on the bone tends to preserve this bone width and allows easy placement of the implant when the patient is done growing. This not only allows good healthy bone at the time of implant placement, but also provides good gingival contours for the margins around the implants. We provide a custom temporary to attach to the end of each TAD. As you can see, this is a very aesthetic restoration for our patients. It must be noted that this is just a temporary means of retention until the patient is done growing, and that the final implant restoration must be done to provide long-term stability. Listen to Madison and Jesse as they describe their experiences and see if you can tell which front tooth has a custom temporary.
Okay, there's a screw in my gum, and then I have a fake tooth, and the screw glues on to my fake tooth.
Which one is?
No, people don't, unless I tell them, they don't notice.
I didn't want to do it because I thought a screw going up into your gum, that was going to hurt pretty bad, but it was an easy process. And he puts a screw inside the tooth and he just screws it up into my gum and it stays there. It didn't hurt. He put numbing medicine, a few shots, and I didn't feel anything. Now I just can eat with it and brush my teeth. It's great.